Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionists, Lauren Papanos and Romana Brennan.
Hello, everyone. Welcome back to Nourish MD. I'm one of your hosts, Romana, joined by Lauren Papanos, our other dietitian. Today, we'll be discussing sleep. And I hope you were able to join us with Dr. Davis earlier this month. We discussed some of the most common sleep issues that he sees among his patients, as well as sleep apnea being one of those. So if you haven't yet had a chance to listen, definitely go back, as we will be talking more about sleep challenges, how to eat for better sleep, how to troubleshoot some issues related to those sleep challenges, also touching on some supplementation and lifestyle changes, things that Lauren and I discuss with patients often on a day-to-day basis. So would love to get started. Lauren, let me know, what are some common sleep challenges in relation to nutrition that you often see among your patients?
Yeah, I mean, there's, like you said, it's just such a common challenge. And there's so many different reasons that sleep difficulties can be challenging. But I think it's very uncommon for people to point to diet and lifestyle, right? Or sometimes maybe we think that it's just something more physiological, something that, our bodies just aren't programmed to do. But there's actually a lot of variables within nutrition that impact your sleep quality and your ability to fall asleep quickly, which we call sleep latency. So I would say one of the most common ones, especially in more of an older population, is waking up often in the middle of the night to go to the bathroom. And there's typically a couple of different reasons for this. Generally people are triggered to wake up because they do have to use the restroom. And that may be as a result to possibly eating or drinking too close to bedtime because maybe your bladder isn't able to withstand some of that pressure when you're sleeping. However, in an ideal situation, when you are sleeping, that's what the role of a specific hormone called antidiuretic hormone is supposed to kick in. And that's what's actually supposed to help to be able to prevent that diuretic effect, to basically concentrate everything so that you don't wake up in the middle of the night. And so although sometimes we kind of point to like, oh, maybe you're drinking too close to bed is the issue, or maybe you're eating too close to bed is the issue, a lot of times it actually goes back to something deeper rooted that's impacting that antidiuretic hormone. And, one of the common things that we see is just erratic blood sugar. And that could be that you are maybe going to bed with high blood sugar issues, where maybe your last meal of the day or whatever you're snacking on before bed is actually causing what we call a hyperglycemic response, to where there's a really large blood sugar elevation that's kind of creating this this wired type feeling, right? And so then your body rebounds to be able to send out the hormones like insulin to be able to help really get rid of that sugar and bring it into the cells that need it. And when that happens, sometimes what can occur is something called rebound hypoglycemia, where people then go low blood sugar. Or you could just be low blood sugar before you go to bed, and then you're entering into an even lower blood sugar state when you're sleeping. And so one of the really great ways to be able to identify if this is an issue for you is testing your blood sugar. There's at-home units that you can purchase, and that something we could even set up for you at PPMA, to where you can finger prick yourself, or you can get something called a continuous glucose monitor, where it runs continuously in the background. And that way you can see what your blood sugar response looks like before you're going to bed and in the middle of the night when you're waking up. This also could be that you are drinking or eating too close to bed. So we always recommend that you're keeping at least a 2 to ideally 3 hour time frame in between your last large serving of liquids and your last large meal. That's just going to help support natural digestive and filtering processes, to where you're less prone to having to get up to go to the bathroom in the middle of the night. So those are some things to definitely identify if you're not already doing that. And then, I would say as well, in addition to that, is just a high cortisol environment. And sometimes this is in relation to that low blood sugar type situation, because our body is going to release cortisol, which is one of our stress hormones, to be able to mobilize what we have in storage as sugar into our bloodstream, because our body always is trying to keep us at homeostasis, or this kind of like neutral ground of blood sugar, right? And so if our body senses low blood sugar, the alarms go off, our body releases cortisol, that stress hormone, so that we can get that sugar back up in the bloodstream. And that cortisol response is also going to wake you up and make you feel very alert. And so this is very common for people that report, I wake up around 2 to 4 a.m. every night. Generally, this is because there's a high cortisol environment going on, whether that's because of the low blood sugar situation, or it's because maybe there is dysregulated, stress happening throughout the day or before you go to bed. And there are things that your brain is processing through while you're sleeping that are impacting your ability to really fall into a deep sleep cycle. So that's probably one of the most common things that I see. I'm sure you see as well, Romana. Any others that you find you're commonly having conversations with patients about?
Yeah, well, I just want to say, I feel like you explained that really well, Lauren. And before we move on, I just want to touch on intermittent fasting versus when might someone, within this context of potential rebound hypoglycemia, when might someone benefit from implementing a snack in the evening time versus someone who might be doing intermittent fasting, who would rather cut off their eating window earlier in the evening. Can you kind of put those pieces together for us?
I think it just depends on someone's individual blood sugar control, and also looking at like their overall lifestyle patterns of what's happening and why is this issue presenting where they're waking up. But yeah, I mean, I have seen that with patients to where, maybe they are eating dinner at 7, but then they're entering into a low blood sugar state by 12 midnight when they're a couple hours into their sleep cycle. And one of the easiest ways for us to troubleshoot that is to do a very blood sugar stabilizing snack right before they go to bed. And that just kind of helps to be able to keep levels stable while they're sleeping. So that can be a good solution for some people. I just think it's so individualized in terms of what your needs are. And there's so many variables that go into that, like your stress levels and, your weight and your activity level, and just so many variables that could be impacting if that might be a good approach for you, or if you're able to intermittent fast and maybe go from like 5 p.m. until 7 a.m. the next day and not eat. Some people can maintain good stable blood sugar by doing that, but others might not. That might not work for them.
Yeah, 100%. And I think that's one of the nice things about working with us in the context of PPMA, is that we can bring that personalization. And another benefit of the concierge medicine model is we can take the time to take your individual needs into account. So thank you for touching on that. And yes, another thing that I notice often is this context of heartburn and reflux, especially people experiencing it when they're trying to go to sleep, having that burning sensation. It can even manifest as just a cough that won't go away. So it doesn't always, reflux might not always look exactly like heartburn, having that typical after your meal. It can also be coughing type symptoms, things of that sort. So certainly what you had mentioned, trying to have a 2 to 3 hour window after you're eating just to properly digest your food, have enough time for your body to understand that it is time for sleep and time for rest. So sleeping too soon after eating, I find being a big challenge for people and a potential cause of these increased reflux symptoms, as well as looking at the composition of the meal. The last meal of the day, are you having high fat consumption? Are you having maybe not enough protein? We still want a complex carbohydrate. So we might just need to evaluate and see, maybe it's too heavy of a meal. You might even notice that the times when you're going out to eat, having a heavier meal, something more rich, that you are experiencing increased heartburn, reflux type symptoms when you're trying to go to bed. So that can be something to take into account as well. We also want to make sure that we are showing up to our meals in a state where we're relaxed. Maybe we need to implement some deep breathing, just a couple deep breaths, to ensure that we're transitioning our body from this heightened stress state, this parasympathetic nervous system activation, and really transitioning into more of a parasympathetic nervous system state. So that rest and digest. We don't want to be in that fight or flight when we show up to our meals, when we are eating, we want to ensure that our body can produce the digestive enzymes, the stomach acid, to support the digestion and absorption of the foods that we're eating. So like I had mentioned, deep breaths, maybe having some type of gratitude practice before your meals. If you have a prayer practice, implementing those types of strategies just to slow down, calm your mind. You had mentioned the cortisol response earlier, and we certainly don't want to be in this high stress state when we're sitting down to a meal, because that definitely can impact our digestion and potentially aggravate any existing heartburn, reflux type symptoms. What are some other things that you've noticed, Lauren, among your patients and clients?
I would say that, difficulty falling asleep is probably another big one. Just poor sleep quality as well, especially sometimes people don't really know that that's an issue unless they're using some type of sleep tracking device that's looking at their REM sleep cycle length and their amount of disturbances throughout the night and their deep sleep quality. And these kind of all go hand in hand between the two of them because, sometimes like simple things such as like having a glass of alcohol before bed, we might think that that actually is helping with our sleep because you might fall asleep faster, but it actually is impacting your sleep quality. And you might just not be able to see that because you're not actually tracking your sleep quality, right? But it's showing up because you're waking up the next day not feeling rested and your brain is feeling foggy because your brain isn't having the time that it needs in those deep sleep cycles to really recover. So those are things to definitely look at. If you've noticed that you have difficulty falling asleep on just like any given day, the first and foremost thing I would look at is what's going on in that hour before bed. And this is something that I personally struggle with. And so I have to be very mindful of what that last hour before bed looks like. If you're on your phone, if you're doing things that are too stimulating, watching television, having heady conversations, getting in arguments, doing things that are going to activate that stress response, then it's going to be very challenging to fall asleep because, as you mentioned, the body's in that fight or flight mode, right? It's not in rest, relaxation mode like it should be to be able to drop into that deep sleep cycle very quickly. So that 1 hour before bed is going to be really important to try to set that boundary and really have some relaxation practices that, and we'll talk about some of these things we can do lifestyle and supplementation wise that should be able to help with that sleep latency as well. Something to also look at too is just like things that you're doing earlier in the day. So, if you're drinking caffeine, even sometimes there are people that are slow caffeine metabolizers. That's something that's genetic. And even a cup of coffee at 10 a.m., it might be too late for you in order for your body to fully metabolize all of that caffeine before you fall asleep. And it might be impacting you more than you think. But I would definitely say starting with cutting off caffeine in the afternoon, really after 12 or 1 p.m., because caffeine half-life is about 8 hours, which means it's probably not going to be fully out of your system till at least 9 p.m. if you've had it at 1 p.m. So really important that we're looking at modifying and eliminating caffeine, especially if you're noticing that your deep sleep cycle, if you do look at any of your sleep data, if you're noticing that deep sleep cycle is being impacted, then it's probably a caffeine issue. Exercise is also really important for good sleep quality. So if you are, again, noticing that a lot of your sleep is light sleep and you're not getting into that deep and REM sleep, then it may be trying to engage in more strenuous exercise in the earlier part of the day, not right before you go to bed, but just making sure that you are using your muscles, that you're being active at some point throughout the day, because it is going to help to be able to increase that need for deep sleep because your body's going to be forced into needing a little bit more recovery during the night. And then in terms of just like other things that go into just waking up often in the middle of the night, I mentioned alcohol and how that's going to actually impact your sleep. You're not going to get as good a sleep as you think you might. And if you do use any type of sleep tracking device, then you'll probably notice when you wake up in the morning, your resting heart rate is more elevated and your amount that you were in a deep sleep and REM sleep cycles was also reduced. But it can also be an issue of hypoxia. So that's where you are not getting adequate breath and adequate oxygen throughout the night. And that's generally because there's something like sleep obstructed breathing or sleep apnea that's at play. And a lot of times people don't even know that they have sleep apnea unless you sleep with someone who's like, yeah, you snore all the time, right? Or you might be breathing through your mouth and not through your nose while you're sleeping. And so you're not getting efficient oxygen delivery. And again, going back to some of these sleep tracking devices, a lot of them can actually tell you what is your percent oxygen saturation. And we want to aim for at least a 98% oxygen saturation. That's going to indicate that you are, getting adequate oxygen and you're not getting into this hypoxia type situation where there's low oxygen supply. You can always go, get a sleep study. That's something we can set up for you if it's something that you suspect. But this is a big conversation that I have with clients, especially those that have blood sugar disturbances like diabetes, because we know that people that have sleep apnea, that they're getting a constant cortisol response throughout the night. And remember, going back to what we talked about just a few moments ago, if there's a lot of cortisol responses happening when you're sleeping because your body thinks it's being strangled because it's not getting oxygen, you're going to be continuing to get these big blood sugar surges. And that's going to actually drive that blood sugar issue and, further drive diabetes management. So, if I'm working with someone and they're making all the great dietary changes and lifestyle changes for their blood sugar, and we're still not seeing big improvements happen, I want to know what's going on when you're sleeping. Are you not getting great oxygen delivery? Because that could be something that's very much contributing to your ability to not just sleep well, but also to control your blood sugar throughout the day.
Enjoy high-quality supplements shipped right to your door with full script through Private Physicians Medical Associates, PPMA. Reap the health benefits of pharmaceutical-grade vitamins while saving 5% on all orders. Set up your free PPMA account today. Visit privatemds.com.
Absolutely. And I find similarly with weight loss resistance as well, this can also be categorized as sleep deprivation. So whether it is impaired sleep or lack of sleep, these things both equally can contribute to weight loss resistance, even weight gain. So similar to how you were saying that if we're not really able to move the needle with some of this diabetes resolution, blood sugar regulation improvement, we definitely want to be considering the role of sleep and any potential sleep apnea issues or hypoxia that's happening overnight. So absolutely. And on a similar note, I find that poor quality sleep too, and waking up not feeling rested is another thing that I notice with individuals. And just to go back to alcohol consumption, we might think, oh, this glass of wine helps me fall asleep and it's calming me down. But we understand better now that that's really kind of just knocking us out, and it's not contributing to quality sleep. It's more of a sedation effect as opposed to helping us feel well rested. So that's why we might wake up in the morning not feeling sharp. And so alcohol consumption is something to consider just evaluating if you're utilizing it as something to help enhance your sleep. Just kind of getting curious about that. As well as, again, we've already mentioned sleep apnea, but can also contribute to you not feeling well rested in the morning. And sleep apnea, of course, can be worsened by alcohol consumption as well. There's also been some research shown that some nutrient deficiencies, micronutrients, vitamins, minerals, if we're dealing with a deficiency, that can impact a variety of different processes in the body, hormonal regulation. All of these things contribute to impacting our sleep for the better or for worse. So it might also be necessary to do some micronutrient testing, which we can help facilitate as well. Something to consider if you're noticing sleep issues, as well as maybe some other chronic illnesses that can also be tied back to nutrient deficiencies. I want to transition to, Lauren, to just some supplementation, things that might be helpful, things that maybe people have heard of for a long time. So let's discuss melatonin. I feel like this is maybe one of the most well-known sleep supplements. So let's get into it. Would love to know your thoughts on chronic use and when to use it, maybe who shouldn't be using melatonin to support their sleep.
Yeah, so melatonin is a natural hormone that's made in the evening time primarily, and it's made from our pineal gland and really in response to darkness. So a lot of us aren't quite making enough melatonin because we're not in a dark environment. We're using electronics and, we're being exposed to light in the evening time when our body should be naturally getting that signal that it's time to make that hormone. Melatonin also is going to work in tandem with cortisol. So again, going back to if your body's in a high stress state, in those couple hours leading up to bedtime, it's going to impair the amount of melatonin production that really floods your brain and that your body is able to utilize. So melatonin is really important. In terms of supplementation of it, some people do report that it doesn't work for them, that it actually makes things worse, or that they wake up feeling really groggy. And there's a couple of reasons why that can occur and that you should know. Melatonin has a lot of purposes outside of just sleep. It's an incredible antioxidant. There's tons of research on its role in the brain and helping reduce inflammation, the immune system, even in helping with heartburn and GERD. So there's tons of different roles for melatonin. We don't always just use it for sleep, but that is obviously a great benefit of it. If you're noticing that it makes you feel really groggy, you're probably taking too much. There is a little bit of a reverse effect with melatonin if you do take too high of a dosage. So we really want to aim for somewhere between 2 to 5 milligrams. And really going over 5 milligrams is probably going to provide the opposite effect, and you're not going to notice that it's helpful. So we want to make sure that we're taking the right dosage, and that's where working with a practitioner that knows your situation can be helpful to understand what your needs are. The second thing is that if you notice that it makes you more wired feeling, then there's actually some underlying causes as to why that is. It actually means that there is high amounts of inflammation that are happening in the brain, and that when you take the melatonin, because it's an antioxidant, it's actually providing a fuel source for the brain. So it's actually lighting up your brain, and it's making your brain more stimulated as opposed to making you more relaxed. And so I know that the immediate solution might be to think, okay, well, the melatonin doesn't work for me and I need to just remove melatonin, but it actually means that you need more melatonin and you need to keep going with it so that you can kind of get over to the other side. However, don't just keep going with melatonin alone. You need to make sure that the brain has some protection first. And that's where things that are called phospholipids are extremely helpful. These are things like phosphatidylserine and phosphatidylcholine. You may or may not have heard of them before. Phosphatidylcholine and serine are extremely important for the brain. And we really want to make sure that we have these in place first and foremost to kind of get things moving along so that as you take that melatonin, it's not causing as much of that lighting up effect, right? And that our cells are actually able to really utilize that melatonin efficiently for what it needs, for the purposes that the melatonin should do. So if that happens to you, then you might be a good candidate for adding in what we call a phospholipid, one of those phosphatidylserine, phosphatidylcholine based options. And then again, going back to just making sure you're taking the right dose, start slow and build up. I like liquid versions of melatonin because you can start with just one drop, half a milligram. If this is happening to you, then after a couple of weeks, you can build up to 1 milligram, and continuing to build your dose rather than just going to the supermarket and buying a 5 milligram capsule of melatonin that may just be too high of a dose for you. So that's the story on melatonin and what you should know about it. However, we want to make sure that we are supporting our body's own melatonin production. And we definitely want to make sure that if we are going to be traveling and we're going to be changing time zones, that we have that melatonin in place to be able to help us really reset our circadian rhythm, because that's what's going to help your body to be able to adjust to that time zone quicker. So for example, if you're on the West Coast and you're going to be traveling to the East Coast, I would recommend that a couple days before you travel, you start taking that melatonin a couple hours before bed so that your brain can start getting that signal of, hey, this is when you should be naturally making the melatonin. It's just going to help your body to be able to adjust once you get over to that new time zone. It's definitely something I recommend if you're traveling internationally where there's much more than just a 3-hour time difference. And it's something that you can do to be able to help reset your body's natural clocks of when it should be feeling awake and when it should be feeling sleepy and time to go to bed. But outside of melatonin, there's a ton of other options that we have out there. And I think that it's very individualized in terms of what works well for some people, because it always comes back to what's the issue at play that's impacting your sleep quality. And based off that is really where we make the recommendation of what is going to work best for you. So outside of melatonin, what are some of the other supplementation options that you see to be really helpful for people, Romana?
Yeah, I find any kind of calming herbs. So these herbs are in different categories, right? So some of which are considered adaptogens. So these calming adaptogens, they work on our nervous system to help promote this relaxation, calming effect in the body. Some of these that I find particularly helpful, valerian, you can find valerian root in a variety of teas, as well as ashwagandha, which is available in so many different forms. You can find it in capsules, tinctures, powder form, and as well as holy basil, which is also called tulsi. This can be found very often in teas. You'll just notice regardless of the type of form, just pay attention to the dosage. And of course, working with someone who's familiar with these types of herbs is important, just to know the appropriate dosage. But I find ashwagandha being especially helpful for individuals. Some people don't respond as well to one as they might to another, similar across forms. So trying out different herbs and forms can be super helpful. And even just warming beverages in general, regardless of whether this is an adaptogen or not, maybe something like a chamomile tea before bed, having that soothing, warming beverage can be helpful for sleep as well. But yeah, so I find herbs as well as vitamin D can actually play an important role. So there's been research to show that vitamin D deficiency in particular can actually increase your risk of sleep disorders and is associated with sleep difficulties, as well as shorter sleep duration, which we've talked about, waking up in the middle of the night, both in children and adults. So at PPMA, we often check people's vitamin D status. It's something that we recommend often. And I've seen deficiency in individuals who have noted sleep difficulty. So it is an interesting connection, kind of going back to nutritional deficiencies being a potential cause of those sleep challenges. So ensuring that you're having appropriate vitamin and mineral levels and supplementing when necessary can not only be supportive for sleep as well as other aspects of your health, because we know how important vitamin D is for bone health, for mineral absorption. So kind of connecting this holistic view of health, better sleep can mean so many other health improvements. So vitamin D, calming herbs are things that I've found especially helpful if you are not someone who wants to take something like melatonin, for example.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.